Hey, good morning. Hey, well, do you recognize your neighbors? This is a representation of our community, of our neighborhood. These little plastic people here kind of show the importance of vaccines and herd immunity. So basically, we're going to talk about the measles right here. This is a measles outbreak simulation. If 60% of the people are vaccinated, then the orange people are those who will get sick. Now, adversely, if 95% of the folks in your community are vaccinated, then literally out of this representation, only one person gets sick. That's because it's something called herd immunity. The more people who are vaccinated, the less the disease or virus has a potential to spread. Joining me now is Dr. Jeff Duchin. You are a specialist in diseases and how they spread, and you're a chief health officer. Tell us how important vaccines are. You said something to me that vaccines are as important as clean water.
Yeah, the World Health Organization tells us that outside of clean water and sanitation, nothing has done more to prevent disease, disability, and death in the human population than vaccination.
Unbelievable.
Yeah, unbelievable. It is one of the greatest accomplishments of humanity with respect to improving our quality of lives.
And it really has improved our quality of life. We're looking at situations like this, disease cases per year in the United States. What does something like this tell us? In the 90s in the 1900s, this was a big issue, and now it's not. How has that really affected the community at large now?
Well, vaccinations not only protect the individual from getting sick and needing to go to the doctor, having antibiotic prescriptions unnecessarily, being hospitalized and dying, but they also protect the community, as you just showed. We can protect those who are most vulnerable in our families, in our workplaces, and in our communities who are either too young to be vaccinated, too old to have a good immune response, or have underlying health conditions that make their immune system weaker. We can protect all of them through getting vaccinated ourselves. So vaccinations not only protect us, they can protect those around us. They can prevent disease, disability, death. They can prevent cancer. Our hepatitis B and our HPV vaccines are actually cancer-preventing vaccines, and they're all cost-effective or cost-saving. So they're a very good deal if you think about the big picture.
And we were talking a little bit about how you were saying to me that a vaccine for HIV is one thing that our nation is spending a lot of money on.
Yeah, there are some vaccines. I mean, we'd like to have vaccines against other cancers. We'd like to be able to prevent HIV and some of the other diseases that are still occurring commonly in our community, Group B strep disease in infants. But vaccines are very difficult to develop. They take many years of basic science, and then clinical studies in humans and safety studies. So it's extremely arduous to get a product from conception to
your doctor's office.
To your doctor's office.
Thank you so much. We're out of time, but I have to say, you've got to come down to the Pacific Science Center and check out this new exhibit. There's so much to learn here, and you can even learn about how we are the hub of vaccine innovation here in Seattle. Live at the Pacific Science Center, Amity Addrisi, back to you.
I love the Pacific Science
Yeah.
for adults. It's a great place to learn a lot. Thank you so much, Amity.